My name is C.Wilkerson, and I am doing my week 5 assignment on depressive, bipolar, anxiety, obsessive, compulsive, and related disorders. Okay, and so I'm going to do my assignment on Mr. Samuel King, who is a 52-year-old male who has been diagnosed with depression for years and has not had any progress with the treatment of prescription medication and psychotherapy. Samuel indicates that he has had little to no improvement with his current treatment plan and needs assistance. Samuel has a full-time job. He has no immediate family and no interaction with other people or outside forces. Samuel also indicates that he has been feeling hopeless. He's been sad, unable to enjoy doing anything. He has trouble falling asleep, and he has trouble sleeping when he does fall asleep. And he is not able to concentrate or make sound decisions. He does not have thoughts of suicide, although he have had some in the past. Samuel's appearance is presentable, but he has a strong odor of cleaning supplies attached to him. He expresses that he has anxiety due to not wanting to catch any diseases, specifically HIV. He washes his hands often, like 30 times a day, and avoids touching anything outside of his home. And when he does go outside of his home, he tends to wear gloves. Samuel does drink alcohol, but he does not use any illicit drugs. Samuel visualizes himself hitting someone and also fears that he might come off a bit offensive to others, and he wants to try to avoid doing that. And the way he avoids doing so is by playing scenarios over in his head, and he writes down things he has said in a journal, and he often apologizes when he feels like he may have sounded offensive to anyone. Samuel has no interest in a love life, communicating with others outside his work environment, or making friends for that matter. He does have a concern as it pertains to his neighbors. He doesn't want to disturb them or flood them by filling his bathtub up too high. So to avoid doing that, he fills his bathtub up to the same spot every day. Samuel does not suffer from any other health issues and is aware that his situation may be kind of crazy, but is out of his control. When it comes to diagnosing Samuel, we already are aware that Samuel has been diagnosed with depression. However, it appears that he may also be suffering from OCD, Obsessive-Compulsive disorder. Samuel washes his hands almost 30 times a day. He's always cleaning and has thoughts of hitting someone, which are all symptoms of OCD. Along with that, Samuel wears gloves to avoid catching a disease, fills his bathtub up to a specific spot every day. He fears saying the wrong things to others and also drowning his neighbors. I have read that representation of OCD is by having recurrent obsessions or compulsions that may provoke or distress and may interfere with the person's social routine or occupational functioning. Due to Samuel not having a life outside of his home and work, along with his fear of catching a disease in the outside world, is a result of him not being able to function in a normal environment. Now, due to the fact that Samuel's situation has lasted for years, right, it appears that his previous diagnosis of depression and anxiety are indicators of a more distinct problem. Depression usually is brought on by a certain incident that, may last a few weeks or maybe longer depending on the situation. I feel like Samuel's depression and anxiety is brought on by him fearing saying the wrong things, obsessing over not catching a disease, his compulsive behavior such as washing his hands over 30 times a day, and also, not having anyone to talk to on a regular basis. When you are experience certain mental issues, it is important to have a sounding board or a support system. And that is something that Samuel is lacking at the moment. He, lacks family and friends. So therefore, he's forced to deal with these things on his own and try to cope with them and, recover from them on his own when he doesn't really know how. So the situation he's put himself in is pretty much adding on more and more problems to his situation by dealing with it alone, in my opinion. Now, I've also read that OCD is very time consuming and it causes deficiency and grief in many varieties of the client's life due to the fact that Samuel is a janitor. His job is to clean, which is good for Samuel because, he's able to function because cleaning is normal for him. He needs everything to be clean and, everything speak and span. But I feel like if Samuel were to be working in, let's say, an office or, any other job for that matter, the results would not be the same. Samuel would not be able to function normally because his obsession and compulsions. Samuel will need to be treated for OCD, and we could rule out his, previous diagnosis of depression and anxiety. Because as I've said before, I feel like depression and anxiety is a symptom of his OCD, with him having his obsessions and his compulsions, and not being able to deal with them. He, depression and anxiety trickles on down the line. It pretty much adds on, depression and anxiety is basically a symptom of his OCD. That's what I'm trying to say. Okay, so let's talk about the different treatment plans. Okay, we can get into the 4 different treatment types for a client with OCD. And we have We have psychopharmacological, psychological, family therapy-based, and biomedical treatments. Those are the 4 different type of treatments. So when we look at the psychopharmacological treatment, we know that, of course, it is when a client is treated with medication, right? And me personally, I feel like Samuel would benefit from this type of treatment because of the depression and anxiety. I feel like when he can be on antidepressants to, help him with that portion. I know he's been on them in the past. However, his OCD was not considered in his depression and anxiety. So, we can treat him with medication for his depression and anxiety. And then we can work on his obsessive compulsion disorder as well. So he can be on those medications at least until, he gets everything under control. And then we have the psychological portion of the treatment. And I think that he would benefit from that as well. So the psychological treatment is when a client attends therapy to resolve their issues, and of course he would benefit from the psychological portion of the treatment because he needs to talk to someone, other than, someone who is in his head, because he needs to get outside of his mind and talk to real people. And then you have the family therapy-based treatment, which treats the whole system together. And then you have the biomedical treatment, which is electroshock therapy. Now, when choosing the right treatment option for Samuel, we want to be sure that we include all of his symptoms, right? So, due to the fact that, the medication, as I said before, got a little ahead of myself. And we want to, due to the fact that the medication has had a mild effect on Samuel, I feel like the psychopharmacological treatment would be the best treatment for his anxiety and depression, at least until he is able to control how he reacts to being part of society, right? We don't need him, staying in his house and, thinking if he has offended anyone for the day, right? We need him to be focused and, aware of his surroundings and, a clear mind, clear thought process. Right. So then Samuel could also benefit from the psychological treatment. It is important for him to have someone outside of his head to talk to, because as I said earlier, he tends to replay different things that he said in his head and, to see if whether or not he said anything offended or he offended anyone or, thought of anything offensive. So I think it'll be a good idea for him to get outside of his head. And talking to a therapist could help with that. It could also help monitor Samuel's behavior more and gear him towards doing the right thing and, a way for him to not think about committing suicide if the urge ever comes up to do so again. It could basically minimize the thought process of killing himself if he actually has someone in his life that he can talk to, and a therapist could be that sounding board for him. I think that would be a good idea, a good treatment plan for him. I feel like the psychological treatment can also help Samuel reinvent himself with society. Right now, his life is waking up, cleaning, going to work, cleaning, going home, cleaning, can't sleep, irritable, no one around, but the thoughts in his head. I feel like if he speaks with a therapist, it can help him discover what he actually wants out of life besides what he is doing now, because obviously what he's doing now isn't working for him. So possibly, come up with ways that he can get himself back out there in the world to talking to other people and getting over his fear of catching diseases. Yeah. So it would be good for him to talk to other people and interact with them. Therapy could help him see the world from a different view if he is open to it, and would allow him to gain a support system that is needed for him to overcome his depression. As it pertains to the family therapy-based treatment, I don't think that's a good treatment for him because he doesn't have a wife or children to account for his behavior at the moment. So, he wouldn't benefit. He's 50 years old, no wife and kids. So we wouldn't do that treatment for him. And then we have the biomedical treatment. Now, the biomedical treatment is basically a last result treatment, right? So when all else fails, such as, his medication or, his antidepressants and psychotherapy, if that doesn't work, psychological therapy, if that doesn't work, then we will move on to biomedical treatment if, that's what he wants to do. So the two treatments that we would use for Samuel, of course, would be the psychopharmacological treatment and the psychological treatment. Those would be the two treatments for Samuel at this time. Now, when it comes to pros and cons of the treatments, right? So we have the psychopharmacological treatment. Some of the pros would be it helping with his anxiety and depression, of course. And it will also help the client, receive help until he's able to, how can I put this? He's able to reach a level of understanding with his therapist. Some of the cons would be, him being addicted to the medication, or, the side effects of the medication. Most medications doesn't work for everyone, and he might have, side effects from it, or he could have side effects, or he can be dependent on the medication. And so then we have the psychological treatment. Some of the pros for that would be, it could basically cater to his specific needs, right? The treatment can. And then he can have, he can be more confident in his decisions, or if we can take things, maybe things have been done one way, we can try different ways to reach the end result for him, whatever works for him or whatever. So you can have different options when it comes to that, which that can also be a con. The first and foremost, the client has to be willing and able to do the work, put the work in, and it may take a couple steps to get him there. He may get frustrated with the different type of approaches that we have to do, and finding the right plan for him. So just hope he keeps an open mind as to, the treatment plan. So when it comes to family therapy, based treatment, of course, my client doesn't benefit from it, but some of the pros of it would be, a support system. He can have a stronger support system. He can be focused, more focused on what he needs to do. And, it can pretty much build the client, when he has the support of his friend. Like, there's nothing more important than the support of your loved ones, and I feel like that would be a good pro for that. One of the pros for the biomedical treatment is that the results are usually immediately. It can cause immediate change with the waves in the brain, and it could also benefit my patient because it can assist with treating OCD. So if the other just doesn't work, we can consider biomedical. But like I said, it's considered the last result. So even though it will help him with the treatment, we'll try the first two first to see how that goes before we, do any of that. With cons, it requires, I think my video is going out, so I'm going to have to do it. Okay, so when it comes to the cons of the family therapy-based treatment, it requires, everyone to be involved. So you have to be sure that everyone is on board with, the treatment process and everything that is needed for the client to actually heal. And another con could be that the client may think that, people pointing the fingers at them. We just want to make sure that they don't think that this is a bashing session, but also a attempt for them to heal. And for the cons for the biomedical treatment, of course, it may be painful, because it's shock therapy. So it may be painful to the client, and it could possibly cause brain damage. So there you have it. Again, I am C.Wilkerson, and this is my week 5 assignment. Thank you.